Olá, boa tarde. Bem-vindos todos a esse seminário extra do Instituto de Microbiologia. O professor Tomislav me permitiu falar algumas palavras em português antes da introdução dele em inglês. Na verdade, é só para dar uma bem breve explicação sobre o motivo que levou a esse seminário extra de hoje aqui. Na verdade, esse seminário representa a primeira aula de uma disciplina da pós-graduação, cujo nome é Tópicos Especiais em Internacionalização. É uma iniciativa da Coordenação de Relações Internacionais do Instituto. Né? A gente criou essa disciplina com o objetivo, então, de ter um espaço para que professores de qualquer lugar do mundo, né, convidados, pudessem dar disciplinas sobre diferentes temas dentro da microbiologia. E essa é a segunda vez em que essa disciplina é oferecida no curso de pós-graduação em microbiologia. E pela segunda vez, quem está oferecendo a disciplina é o professor Tomislav. E a disciplina é sobre microbiologia de infecções sexualmente transmissíveis. Então, só para que o Tomislav possa acompanhar agora o resto da introdução, eu vou fazer a apresentação dele em inglês. Thank you, Tommy. And Tomislav is a medical doctor. He's also a PhD. He's an assistant professor at University of Zagreb, and he's a specialist in clinical microbiology and sexual medicine. He has many collaborations around the world, for example, with Harvard University and also with the University of Washington, where he is now, collaborating in the global burden of disease and global burden of antimicrobial resistance. He's currently a Fulbright scholar there. He's an author of several publications, and he's also very active in different international committees, such as the one in the American Society for Microbiology, where I met him, but also in other international societies and committees. And Tom is also an avid lecturer, a science proponent of science diplomacy. And on top of that, he's also my friend. So thank you, Tommy, again. This seminar in the course. And whenever you're ready, you can start. Thank you.
Thanks a lot, Tatiana. Thank you for this wonderful introduction. I hope everybody can see me and hear me properly. If not, just shout out, so we will try to change something. And it is my pleasure to be with you at this university and in this course. And before I start, I would like to say boa tarde a todos e bons estudos. So I hope you will have fun studying this very important topic and also learn a lot of new things that may help you in the future. So I hope you can see my presentation, and I will start by highlighting several important facets of sexually transmitted infections, which will be the crux of our study in this course. And the problem is really, really huge. There is more than 1 million sexually transmitted infections acquired each day around the world. The majority of them don't have any symptoms, but if you translate these to the yearly number, it's approximately 370 million new infections with one of four most important STIs. These are chlamydia, gonorrhea, syphilis, and trichomoniasis. And more than 500 million people aged between 15 and 50 years of age are estimated to have, for example, a genital infection with herpes simplex virus type 2, commonly known as genital herpes. Then, for example, human papilloma virus infection is linked with more than 500,000 cases of cervical cancer each year, and 300,000 women die each year due to cervical cancer. And for example, if we look at the pregnant women, almost 1 million pregnant women are estimated to be infected with syphilis on a yearly basis, which then translates to a lot of stillbirths and newborn deaths. So this is a huge issue, and numbers are getting worse for some of the infections, which is why we have to address this growing importance and exploit the weaknesses of these organisms where we can effectively tackle them and translate to better health outcomes. And here it would be good to immediately differentiate what is sexually transmitted infection and what is sexually transmitted disease. The main difference is that we call an infection when microorganisms enter our body, start multiplying in human tissues without necessarily causing the disease. And when tissues are disrupted and this multiplication results in certain symptoms, then this is something that we call an infectious disease. And although these two terms are often used interchangeably, I believe delineating them immediately will help in putting them into context. And this is why sometimes we say STD, sometimes STI, but a better term would be sexually transmitted infection, because here then you also account for asymptomatic infections. Here I would like to stress that sexually transmitted infections have a direct impact on sexual and reproductive health, not only through a plethora of consequences such as infertility, cancers, various others, gynecological tumors, pregnancy complications, but it also can result in stigma and psychological consequences. And this is something that we have to have in mind. And also, what will you learn during this course is that, for example, infections with chlamydia and gonorrhea in women are usually without any symptoms, but then if you leave them untreated, they can migrate upwards from the lower reproductive tract to the upper reproductive tract and then lead to pelvic inflammatory disease, which means inflammation of uterus, fallopian tubes, ovaries, other pelvic structures, and then can lead to a myriad of different consequences, such as chronic pelvic pain, ectopic pregnancy, even infertility. This is why this topic is really important to us. And also, if you have these infections in pregnant women, it can again translate to fetal loss, to stillbirths, low birth weight, also eye and lung damage in the newborn. These are all very serious complications, potential complications of sexually transmitted infections. The most recent study that was just published in the journal Lancet, Infectious Diseases, showed the global burden and trends of sexually transmitted infections from 1990 to 2019, and also showed considerable variation, up to 5 times, in the burden and trends of sexually transmitted infections across the globe, both if we look overall and if we look at particular infections across the world. But in general, as you can see in this map, Sub-Saharan Africa and Latin America and the Caribbean are, and during this period were so-called hotspot regions that had the highest age standardized incidence rate of total sexually transmitted infections in 2019. But in any case, if we look at the number of infections between 1919 and 2019, the absolute number of infections increased. Also, what was evident from this study is that younger people have a higher STI burden than other age groups, with very increasing trends. And this study has shown that this is also pertinent for syphilis, a disease that we thought was part of the history. Now it's rising really, really steadily, and we will have a complete separate lecture on syphilis during this course. And also, what was notable from this study is that males had higher age standardized incidence rates and cases than female individuals. But of course, due to different complications that can arise in female individuals, overall they are more impacted with the STI burden and problem than males. And on this image, you can see the growing burden of STIs in accordance with Social Development Index. Most important diseases that we will cover in this course are here. And you can see here with the colors, genital herpes is in blue, syphilis is in purple. I don't know how good you can see, but I can see at least on this screen. Gonorrhea in green, chlamydia in pink, and trichomonas in orange. And you can see how the burden steadily increases, how the number of infection increases throughout the years covered in this study. And this geographical pattern also aligns with previous findings of the World Health Organization in 1999, where Sub-Saharan Africa, South and Southeast Asia, and also Latin America had the highest age standardized incidence rate of disease. Some of the contributing factors, which is recognized by many studies, why this is happening, it's especially in these countries, it's poverty and sometimes poor access to healthcare, lower awareness of sexual health, inadequate screening efforts, but also a lower proportion of treatment, which together makes these countries more susceptible to sexually transmitted infections than high-income countries. So in the subsequent campaign of eliminating STIs, more attention and health resources will have to be implemented in low and middle income countries. And then you have drug resistance, especially for gonorrhea, as a major threat to reducing the burden of STIs worldwide. And on this CDC graph, we see that whenever a new antibiotic against Neisseria gonorrhea has been introduced, the microorganism evolved really quickly to become resistant. And luckily, this isn't the problem for all STIs. Some of them, you will see during this course, don't have any tendency to become really resistant like gonorrhea. But you can see here how big of a problem is for Neisseria gonorrhea. And also, when we consider different group of our organisms like viruses, HIV is also a microorganism with which we have a big problem with drug resistance. And then this basically invalidates a lot of treatment that is being used against HIV, but also drugs that are being used for pre-exposure and post-exposure prophylaxis. This is also endangered by the evolving resistance issue. So much can be done to control the spread of STIs, to diminish the harmful consequences and greatly improve people's quality of lives, and to address this global and critical issue, and also to enable countries to reach targets set for the relevant sustainable development goals. This is something all countries aspire to. The World Health Organization developed a global health sector strategy on STIs, and this was adopted by World Health Assembly. But one of the prerequisite steps and crucial parts of this and how to achieve this is to know as much as possible about these agents that cause sexually transmitted infections. And because only fundamental insights in the microbiology of sexually transmitted infections can open the door for improved clinical approaches, this is something that we need, and this is one of the reasons why we have this course now. And of course, this can then translate to drug and vaccine development in the future. So, after addressing shortly this huge burden of STIs, which will be further addressed during this course, as you will see in depth, with concentrating on the microbiology of these agents of sexually transmitted infections, I will now shortly introduce myself, just to see my career, just for you to see my career path and what is my experience, both research and practical experience in the management, and also obtaining some fundamental insights of microbiological agents of sexually transmitted infections. So in 2007, I finished med school at the University of Zagreb. And then between 2010 and 2014, I enrolled in PhD program. And even there, I already started with some research endeavors in sexually transmitted infections. So my PhD thesis was exploring in vitro efficacy of azithromycin, doxycycline, and levofloxacin against urogenital chlamydia trachomatis strains. And but after that, I saw that just getting some fundamental microbiological knowledge on these agents of sexually transmitted infections won't be enough to tackle this problem in depth. This is why I also pursued Master of Science in Public Health at the London School of Hygiene and Tropical Medicine, which supplemented these fundamental insights I had perfectly. Also, concurrently with my PhD training, I was enrolled in my clinical microbiology specialist training, which is a 4-year residency program in Croatia. And when I passed the specialist exam, basically I became the specialist in medical or clinical microbiology and parasitology. And in order to get more tools on how to conduct clinical trials also, because as a medical doctor and clinical microbiologist, I also work with patients, I enrolled to Global Clinical Scholars Research Training Program at Harvard Medical School. And even there, my capstone project was tackling some novel pharmacological strategies on how to manage, again, some urogenital infections in women. And all this career path also enabled me the opportunity to go to the sexual medicine specialist exam on the European Union level, which I passed and which now also helps me to tackle this problem from many different facets. Regarding my academic positions, I'm an associate professor at Univeristy North in Croatia. This is my primary institutions. Previously, I held some positions, teaching positions at Bjelovar University of Applied Sciences, University of Osijek Faculty of Medicine, University of Zagreb. These are some institutions that I still collaborate with. I was also mentoring graduate studies at the London School of Hygiene and Tropical Medicine. Some of the courses I coordinate are really relevant for this topic, such as sexually transmitted infections in clinical practice and sexual and reproductive health. These are the courses that are conducted in Croatia. And also at the moment, I'm a Fulbright visiting scholar at the University of Washington School of Medicine, as Tatiana already mentioned. Here I'm involved in the Global Research of Antimicrobial Resistance, or GRAM project, which is a project that's conducted in partnership with the University of Oxford in the United Kingdom. And recently, the biggest study on antimicrobial resistance, the most comprehensive insight to date, was published, which showed that in 2019, approximately 5 million people who died suffered from at least one drug-resistant infection. And on the other hand, antimicrobial resistance was directly responsible for approximately 1.3 million of those deaths. And this study has clearly showed that some common infections, such as lower respiratory tract infections, bloodstream infections, intra-abdominal infections, are now killing hundreds of thousands of people each year just due to resistance. And this also includes some historically treatable illnesses, such as pneumonia and foodborne elements. So this problem was shown to be really huge, and everybody is at risk from antimicrobial resistance. But the data shows that young children are particularly affected, and 1 in 5 deaths in 2019 attributable to antimicrobial resistance occurred in children that were younger than 5 years of age. And this was often from previously treatable infections, which is why this problem is even more important. And again, comparable to the STI burden, you can see on this image on the right that Sub-Saharan Africa also faced the highest burden of antimicrobial resistance, with more than 250,000 of deaths due to AMR in just 1 year in that region, and especially high from diseases that are vaccine preventable, like we have a vaccine for Streptococcus pneumonia. And in Sub-Saharan Africa, there was a high burden of resistant strep pneumo strains responsible for deaths. But nevertheless, high-income countries also face significant threat, most notable for E. coli and Staphylococcus aureus, which are a well-known bacteria to you. So yeah, I invite you to follow the GRAM project, and we have some other studies planned that will be released soon. I also have, like I mentioned, clinical expertise, as I was a laboratory director at the clinical microbiology unit in the private sector. I also head of the sexually transmitted disease clinic for men and coordinator of the interdisciplinary clinical research unit. I was also consulting for our biggest pharmaceutical company for the development of certain vaginal tablets that were targeting some sexually transmitted infections. And also I am expert evaluator for the European Commission research agency where every year practically I evaluate some project proposals and fellowship proposals that come to the European Agency from all around the world. So as I mentioned, when I started my PhD, I immediately got involved in the field of chlamydia research. This was actually the first time that we tried to see what is the situation with susceptibility of chlamydial strains in one country that has a really high prescription rates of azithromycin, which is a primary treatment for chlamydia. And of note, azithromycin was developed by Pliva pharmaceutical company. And this is maybe one of the reasons why it's so highly prescribed in Croatia, but also because this is really an efficient drug for many different indications. And again, it's the primary treatment for chlamydia. And we wanted to see whether there was any populational shifts in minimal inhibitory concentrations of chlamydial strains due to this high prescription burden in our country. So this was the topic of my PhD. This was the first time in Croatia the antimicrobial sensitivity testing of chlamydia has been ever pursued. So this was the reason why this PhD translated to several important publications, also some invitations for writing a book chapter on how to standardize this method even further. So some lessons that I have acquired from this PhD were really, really insightful and prompted my career even further. But of course, chlamydia trachomatis was not my only interest in regard to sexually transmitted infections. Some other areas of interest included also viruses, especially human papillomavirus or HPV, human immunodeficiency virus or HIV. And I had some studies assessing the prevalence of HIV and optimal approaches for HIV testing in different countries, such as Sri Lanka. Also assessed together with the University of Washington the global burden of HIV and global forecasts up to 2030. And also I had some practice-led papers, for example, case report on how to optimally choose the treatment when you face intraurethral warts in men. How is the distribution of HPV types in men? So many publications covered HPV and HIV from practical and from academic perspective. Also, some other bacteria that are maybe not so prominent, so to say, as chlamydia, gonorrhea, and syphilis, were also part of my research interest. There are some bacteria in the male urethra that we consider like commensals, but the question is whether they can become pathogenic in certain instances. So this was also part of my research. And there were especially some Corynebacterian species, such as Corynebacterium glucuronolyticum. And I was assessing whether this can also become pathogenic and may be considered like an agent of sexually transmitted infections. And also whether it can impact some of the semen parameters in men and result maybe in reduced fertility. So this is something that I thought it is important to assess further. And also Mycoplasma genitalium, one of the more recently discovered mycoplasmas. It's highly pertinent for male urethritis, but also I aimed to assess whether there is a necessity to screen for Mycoplasma genitalium in women, and which populations are especially at risk for this bacterium and which population should be screened. This is also something that I aimed to assess. Also, due to this problem of resistance emergence, there is always an issue and a need to develop new, so to say, antibacterials, maybe with a different approach. And for example, in E. coli, we have adhesive organelles that are their principal virulence factors that they use to attach to our cells. So maybe one of the options that maybe is not explored so much thus far is anti-adhesion strategy. And in several publications, my research team proposed an anti-adhesive dual targeting approach towards adhesive proteins placed on these key virulence factors of E. coli, they're Fimbriae and pili. And you can see the formula here. Such dual antagonists can maybe contain mannose and natural cranberry containing polyphenols joined together. And this may be the way how to more efficiently block the infection and prevent the progression of disease. And also, a couple of months ago, I published this study together with co-authors from Croatia and Hungary, where I appraised whether the encapsulation of antibiotics in liposomes can be considered an effective approach for improving local effects, for improving bioavailability, biocompatibility, antimicrobial activity of drugs that are used to treat chlamydia, especially azithromycin. And in order to test whether liposomes could enhance the antichlamydial action of azithromycin, we encapsulated azithromycin in different surface charged elastic liposomes. And then we assessed their antibacterial potential activity against Chlamydia trachomatis. And then we showed that this liposome encapsulation not only improves the effectiveness, but if you can use it locally, then this may be even a good approach how to treat chlamydial infections. But notwithstanding all the research and clinical notwithstanding all the research and clinical successes that I have, I also always tend to do some science promotion and leadership activities, trying to combine both antimicrobial resistance field and urogenital infection field. And of course, here are some of the snapshots. You can see me together with Tatiana, how we co-organized a track hub session at ASM Microbe 2018 in Atlanta, entitled The Global Scenario of Antimicrobial Resistance. Do developing and developed countries share the same threats? As I mentioned, this biggest paper on antimicrobial resistance, we saw how basically sub-Saharan Africa has the really, really high burden together with some other parts of the world. So these topics are important, will be even more important in the future. And also, as I mentioned, the increasing resistance in gonorrhea, I think this is something that we will have to put emphasis in the future. And as previously, I was also an antibiotic action champion of the British Society for Antimicrobial Chemotherapy. So this is also something that I tried to promote, the prudent use of antimicrobial agents, especially in the context of sexually transmitted infections. I also was a part of the first Croatian microbiome project, where we tried to compare individuals with inflammatory bowel diseases and healthy individuals and see whether the microbiomes in the gut differ. And we got some interesting results that I can also share with you later. But one of the outputs of this project was also a rederivation of the number of gut bacteria to human cells ratio. For example, often in the publications you can see that researchers or scientists or science communicators state that our gut bacteria outnumber the number of our cells by 10 to 1. Actually, the ratio is closer to 1.3 to 1. It's still really, really impressive in the favor of bacteria, but there are a lot of different factors that enter this calculation. So I also invite you to read this paper if you want to know more about how to compare the number of bacterial cells in our body to our human cells. And of course, I try to communicate the problem of sexually transmitted infections, antimicrobial resistance, and some other pertinent topics as broad as possible. And this is where my passion for science communication, science journalism, and science diplomacy comes into play. But what would I also like to highlight is that I'm the country representative, but also global coordinator of country representatives for HIFA. HIFA is short for Healthcare Information for All. This is one notable organization stemming from the United Kingdom, which has basically started with a vision of a world where every person will have access to healthcare information they need to protect their health, but also health of those of whom they are responsible. And primarily this is addressing healthcare workers. And today HIFA is a network with more than 20,000 members, which includes scientists, healthcare workers, librarians, policymakers, various publishers, which represent more than 2,500 organizations from almost all countries in the world. And recently we had a thematic discussion on HIFA, how to enhance the quality of health services across the health system. This was in conjunction with WHO Global Learning Laboratory. And we aimed to connect everyone involved in quality health service to share knowledge, experience, and ideas, to challenge these ideas and notions that were being discussed. And this rich discussion has been synthesized into a number of publications on the HIFA and the WHO websites, and resulted in 3 action briefs and an integrated brief on how to improve quality of health. And for all of you who are interested, I can also share the links, and you can then check these briefs. But I'm also mentioning the HIFA because there is also a Portuguese version of HIFA, because HIFA interacts basically on 6 global forums in 4 languages, and one of them is Portuguese. So you can also join HIFA Portuguese, follow the discussions. I think maybe you'll find it pertinent, and also find some projects that are conducted together with PAHO, Pan American Health Organization, and together with the World Health Organization. If I want to highlight some other important positions, I'm also in the managing committee for the European Sexual Medicine Network, where I'm involved in the working groups that tackle especially the problem of sexually transmitted infections. And also I'm the education officer in the executive committee of the ESCMID study group for mycoplasma and chlamydia infections. And ESCMID is short for European Society for Clinical Microbiology and Infectious Diseases. And this is also somewhere where both Tatiana and me collaborated. And here in ESCMID, I can also steer some research and education endeavors in the field of chlamydia and mycoplasma, which are, as you will see, very important sexually transmitted infections. So now I will shortly just announce the course and what is expected in the course and what is envisioned. This course plan will also be shared with you later today, together with some of the first lectures. But today is the official day when the course starts. It entails 30 hours, which will be divided between 15 hours of video lectures and 15 hours of your independent studies, writing assignments and preparing for the presentation. And of course, with the objective to gain some advanced microbiological knowledge of pathogens that cause sexually transmitted infections, to explore rising resistance trends, as we already mentioned, gonorrhea and the problem of resistance in gonorrhea, but also to show some breakthroughs in diagnostic procedures and tests that are being used to diagnose sexually transmitted infections. We will also cover the microbiome of human genital tract and the current state of knowledge, how to maybe manipulate this microbiome, and what are the preventative options to even stop STDs from occurring. So from the learning outcomes, what I would like to emphasize is one of the key learning outcomes is to provide you with a broad knowledge of relevant microorganisms that cause sexually transmitted infections. From the taxonomical and nomenclature perspective all the way to physiological perspective, molecular mechanisms, and also how they develop antimicrobial resistance phenotype. One of the learning outcomes is to understand the wide array of diagnostic methods, from the classical ones to the most recent state-of-the-art methods. Also, one of the outcomes is to understand how they cause sexually transmitted infections, what is the pathophysiological process underneath, and how the antimicrobial treatment can work in halving the infection cycle at both the cellular and molecular level. Also, we will tackle epidemiology of sexually transmitted infections. As I highlighted, the global burden today. With each microorganism that will be covered during this course, you will get some epidemiological perspective, and also how to use maybe some preventative options such as vaccinations in our fight against some of the sexually transmitted infections. And one of the outcomes is also to work collaboratively, at least in one of the assignments, and to critically appraise the content of the course and to apply the knowledge. This is why the collaborative assignment will be at the end of this course, to apply this knowledge in analyzing research papers and real-life scenario examples. So the grading scheme will consist of 4 parts. You will have 2 short essays. Each of them will consist of 25% of the grade. You will have a team case report presentation that will discuss a real journal published medical case from Brazil. That will be 25% of the grade. And in the end, there will be a short online quiz on the Google Classroom, which will also consist of 25% of the grade. And you will see these video lectures that will be provided to you will cover one topic, will be self-standing. You will have the opportunity to go through this video lecture at your own convenience whenever you will have the time and whenever you find whenever you find time to go through the lecture. Of course, it will be supplemented with a PDF of the presentation, so it will be easier to handle the presentation. And with each video lecture, I will also upload some new supplementary and optional reading materials, so you can boost your knowledge there as well if you want. So today we have this presentation all the time, when I try just to shortly introduce the burden and problem of STIs and to introduce the course. But later today, 2 introductory video units and presentation PDFs and supplementary materials will be uploaded. And these 2 introductory video units will cover the global epidemiology of sexually transmitted infections, and also give some insights into the mucosal immunity and resident microbiome in the human reproductive tract, and its importance in preventing this region from pathogens that can potentially cause sexually transmitted infections. On May 4th, there will be 4 video lecture units uploaded that will cover bacterial sexually transmitted infections, together with PDFs and non-obligatory reading materials, of course. And these 4 video lecture units will cover chlamydia, gonorrhea, syphilis, and genital mycoplasmas, and also other emerging bacterial sexually transmitted infections. So this will be the bacterial module. And this bacterial module will be the basis for the first short essay that is expected from you, which will be approximately 500 words in length, covering fundamental microbiology of sexually transmitted infections. And the topic of the first independent study task will be to compare and contrast immune evasion mechanisms of bacterial sexually transmitted agents. And the assignment will be due on May 13th, 2022. But don't worry, all of this will be additionally announced in the Google Classroom as well. Here is the submission email, which will also be announced in the Google Classroom. You will have a complete list of all the course outline, course schedule, and all these deadlines for your easier, so you can track the course more easily. Then on May 11th, 3 video lecture units that cover viral sexually transmitted infections will be uploaded, again, together with PDFs and non-obligatory reading material. And these 3 lectures will cover human immunodeficiency virus, or HIV, human papillomavirus, or HPV, and genital herpes, viral hepatitis, and other viruses of importance for the STI field. And again, this will be the basis for your second independent study task or second short essay that will be also approximately 500 words in length, covering laboratory microbiology of sexually transmitted infections, with a topic to compare and contrast testing options for HIV, HPV, and genital herpes. Here, the assignment due will be May 20th, 2022. So you see, for the first independent study task, we covered fundamental issues in medical microbiology. Here, we try to cover laboratory or the diagnostic part by comparing different laboratory assays for various viruses that can cause STIs. And then on May 16th, 3 video lecture units covering parasitic and tropical sexually transmitted infections will be uploaded. And these will cover trichomoniasis, but also pubic lice and scabies, which you will see can also be sexually transmitted. It will cover some tropical STIs such as lithogranuloma venereum, chancroid, and granuloma inguinale. And also, you will have a complete separate presentation on microbiology of the vaginitis syndrome, which can be caused by trichomonas, but you will see can be caused by some other bacteria, and it's mostly in the line of disturbing the normal microbiota of the vagina. And you will see whether these agents are truly considered STIs or not. This will be a very interesting topic. And then on May 19th, 3 video lecture units that cover topics on the treatment, prevention, and emerging antimicrobial resistance will be uploaded. And these will cover not only oral antibiotics that can be used and parenteral antibiotics that can be used against STIs, but also topical microbicides. And also it will cover vaccines where available. And where not available, what is currently happening in the vaccine development for some of the STIs. A complete separate lecture will be devoted to the emerging antimicrobial resistance in sexually transmitted pathogens. As we have seen, this is very, very important topic. And one separate lecture will be devoted to probiotics against sexually transmitted infections, and where is the current state of research at this moment. For the third independent study task, we will create 4 small groups comprised of 3 students, maximally 4, but I think we will have exactly 4 groups of 3 students. The breakdown will be announced on Google Classroom. You will soon be able to see which students are in your group and then start to communicate in order to develop the assignment. And the assignment will be to read one of the open access case reports published in the peer-reviewed journal that tackles clinical presentation and, in some instances, treatment approach of certain sexually transmitted infections in Brazilian patients. And it is expected from you to develop a short PowerPoint presentation that will be shown at the final seminar on May 27th. We will arrange the exact time when the presentations will be shown, but 2 years ago it was, or a year and a half ago, it was really, really interactive and really interesting. And I picked some new cases for this year that I think will prompt a really well-developed discussion. So, for example, how Neisseria gonorrhea can affect the heart and cause gonococcal endocarditis. How chlamydia trachomatis, as we mentioned, can move from the lower to the upper genital tract. What happens if it comes to the peritoneal region? It can also cause ascites. Really, really interesting case. Also, one of the cases will show an unusual presentation of disseminated oral HPV infection after combined treatment against HIV is introduced. Really, really interesting case as well. And also what happens with genital herpes in an HIV-infected female patient when you have some hypertrophic lesions, and how to optimally approach the treatment. So I think you will find these cases really interesting. And after we go through the classical presentation of these STIs, through the microbiology of these STIs to see what else can happen when you are infected with some of the sexually transmitted disease agents. The presentation, okay, this information will be provided to you in the Google Classroom, but it's not expected to be longer than 10 minutes and 10 slides. You will cover the basic aspects of the case report, and then this can prompt a really, really fruitful discussion on whether the approach was good, what could be done differently, and of course, what are the lessons learned from this case. And we can also discuss what were the lessons learned from the whole course during these seminar presentations. And of course, the presentations will be also sent to my email at the day of the presentation. So I can also have a view before we start with the presentations on the date. In the end, the course will have an online quiz, online exam that will be held on Google Classroom. It is not hard. It will be a multiple choice question format with one correct answer. And the exact date will be agreed with Tatiana and the Federal University of Rio de Janeiro. It will be maybe a week after the seminars. We will see when the exact date will be. I'm always available for any course or content questions. I will respond to you within one day. Maybe one of the ideas that may be prudent is to select a student representative from you. It's not a big group, but maybe somebody would volunteer for that position, for managing this course, managing questions, managing anything that should be changed much more easy if we have a student representatives. Also, since I come from Croatia, maybe not all of you are so familiar with Croatia, so I would like to share some facts about my country. So it's a country in Europe, in Southeastern Europe. We are a part of the European Union. Capital of our country is Zagreb, and the official language is Croatian. And the currency is Croatian kuna. Euro will be introduced soon, some say next year. So like a joint currency from the European Union. But for now, we still have our own currency. And population estimate for 2022 is 3.9 million people. So when you compare this with the population of Brazil, I think that we can be considered just like one city in Brazil, the whole country. But nevertheless, as you will see, we have something to share about the country as well. So this is the age breakdown in Croatia, and as you can see, we are rather an old country. High percentage of the population is older than 45 or 50 years of age, which is also in contrast with the population of Brazil, for example. But maybe to emphasize that not only Brazil has beautiful beaches, but also Croatia. Tourism dominates the Croatian service sector. It's a big chunk of our Croatian gross domestic product, or GDP. And you can see on the picture on the left, it's a city of Dubrovnik. It's a city in southern Croatia, fronting the Adriatic Sea. And it's known for its distinctive old town, which is encircled with massive stone walls that were completed in the 16th century. And maybe some of you have watched the TV show Game of Thrones. Dubrovnik was used for many scenes there. And maybe also an interesting factoid, Dubrovnik had the first quarantine in the world in the 14th century, where everybody who arrived at Dubrovnik had to stay for 40 days. That's why it was called quarantine. So this is something that may be interesting to you to remember Dubrovnik. And on the right, you can see Plitvice Lakes. It's one of our most famous national parks. It's known for a chain of 16 terraced lakes, which are joined by waterfalls, and then they extend into the limestone canyon. And you have a lot of walkways and hiking trails across the water. And We also have electric boats that link different lakes. So it's really impressive, and we also have a lot of tourists here. So if you visit Croatia, Plitvice Lakes will be also something very, very important and interesting to see. Some other interesting details about Croatia that you may have not known. So Nikola Tesla was born in Croatia. Nikola Tesla discovered the principle of rotating magnetic field in the 19th century. This enabled the creation of the first electromotor running with alternate current. So Tesla is not only the Elon Musk car, but also one of our scientists from Croatia, and a genius that discovered practically many important things that we still use today. Also, the pen was discovered by a Croat, Edward Penkala. It's called pen because of the first 3 letters of his name, Penkala. This is also something interesting. And also the tie is a Croatian invention. In the 17th centuries, the Croats made it a custom to put a piece of textile around the neck as a detail of fashion, and it kicked off. And now the tie is a classical brand all around the world, classical detail that is common for many official occasions. Also, we had some ancient discoveries. So in one other national park, Veliki Brijuni, there are more than 200 footprints from dinosaurs. We have ancient arena in the also coastal city of Pula, where we put the biggest tie in the world just to represent this Croatian discovery again. And Croatian islands have a lot of living fossils. So, for example, in caves of Hvar and Korčula, which are 2 notable Croatian islands, there are new types of very small lobsters, which are survived examples of species that died out long ago. So we are also famous for many fossil discoveries. And we are also quite prominent in sports. So, for example, our Olympic skier, Janica Kostelić, became the most successful ever in the Olympic Games with her many victories and gold medals. Also, soccer is huge in Brazil. And in 1998, Croatia was also 3rd in the world Cup. And 20 years later, in 2018, as you remember, we were in the last World Cup final. So this is something that we are maybe close to Brazil in regards to soccer or football. And also we're quite good in tennis. Croatia has a Wimbledon and a US Open champions in tennis. We have 2 Davis Cup wins, but also other sports like water polo, like handball. We were frequently world and European champions. So small nation, but with many relevant sports results. In regard to higher education system in Croatia, we have in total 55 institutions of higher education in Croatia. We have 8 public universities. The University of Zagreb is actually the oldest continuously operating universities in Southeastern Europe. It was founded in 17th century. Actually, the University of Zagreb was founded even earlier in 14th century, but then it was inactive in the most part of the 19th century. And then it was renewed in 2002. And we also have universities of applied sciences and many other private institutions for higher education. The higher education in Croatia is a part of Bologna process, with an aim to harmonize the system of higher education in Europe and to create a European higher education area. Basically, now all the university programs are divided and structured in accordance with 3 cycles: undergraduate, graduate, and postgraduate cycle. Usually, and most frequently, undergraduate cycle is 3 years, graduate cycle is 2 years, and postgraduate cycle usually pertains to PhD programs, which last minimally 3 years, but usually much longer, in accordance how the research is going, how the dissertation is going, and everything else. The point being is that European education system now relies on transferable credits. so-called ECTS points, which makes it easier if you start studying somewhere in the Europe to transfer your studies in some other city or country, or if you study abroad to have your degree more easily recognized in the home country. And this functions rather well, this Bologna process. And with some smaller reforms, I think it will still be maintained like this in the years to come. So I think this collaboration with Federal University of Rio de Janeiro opens other avenues of potential collaboration, such as hosting workshops, conferences, and other events in our respective universities. Opens the door for some joint programs and short-term research projects, for visiting seminars, maybe to collaborate on joint publications and textbook chapters, to participate in joint courses, and also maybe to develop some exchange programs in the future between our two countries. Of course, some of the joint goals are to disseminate our research and our scholarly communications in a much better fashion, to try to improve teaching excellence, research excellence, and integrity, also to improve the global presence of our universities in the global map, and to promote diversity and inclusion as much as possible. So thank you for your attention today during this live lecture. And I hope you will enjoy the course, and I'm always open for your questions and anything that you want to achieve, anything that you want to propose. I'm always there. You can feel free to send an email. And I already see a question from Roberto Guardati in regards to the antibiotic resistance in sexually transmitted infections. And the question is whether there is a reason why some infections are more prone to developing multi-resistance. So here the thing is that pathogens that cause sexually transmitted infections vary greatly. So you will see some of them as chlamydia, basically has to enter our cells to cause the infection. And so because of that intracellular localization, it is less prone to developing resistance when compared, for example, to Neisseria gonorrhea, that has many mechanisms to capture, for example, naked DNA from the environment, to capture these maybe some of the genetic elements that can predispose the microorganism to develop resistance. So it really actually boils down to the microorganism, to its structure, to its physiology, to the way how it causes infection, and to the way how it exchanges the genetic material. Those that more readily exchange genetic material are more prone to develop multi-resistant phenotypes in comparison to those that are maybe protected inside the cell, or that maybe have a different structure, or maybe have a different way of causing the infection. Also, in regard to viruses, you will see that, for example, herpes virus and HIV can develop a resistance to the drugs that we use to treat them, and also viruses can mutate more readily. So this is also one of the reasons. But you will see during this course all the mechanisms different pathogens have, why some of them are more prone to the resistance, why some of them basically never develop the resistant phenotype. So thank you for a question, really important one.
Thank you, Tommy. Thank you for this great presentation and for accepting again our invitation to give this course. It was really interesting to know all the things that Croatia has given us. Game of Thrones, pants, ties, really interesting. I also have a question for you, because you mentioned very quickly during your presentation about vaccines, the development of vaccines to STIs. And where are we standing now regarding vaccines for some of these STDs?
Thanks so much, Tatiana. Really, really important and pertinent questions. Thank you for highlighting also Croatia and why it is famous. So regarding vaccines, also students will see during the course that we don't stand so good for many of the sexually transmitted infections. Basically, some vaccine candidates are in development for chlamydia trachomatis, but still there are no really clinical trials that are close to maybe put the vaccine on the market. Some of them are not even close to the vaccine development, but from some of them we have experience. For example, for trichomonas, we have experience for some vaccine candidates that were used in the animals. Now we are trying to translate that to humans. Of course, one of the biggest dreams would be the vaccine against HIV. There is some maybe promise in the next few years that we'll have a viable candidate, but so far we didn't have luck. What we have and what is good is the vaccine against HPV, which now we even have a 9-valent vaccine, which is really good. And the vaccine against HPV was used basically pervasively in Australia, and Australians have managed to basically eradicate the cervical cancer, which you will see is caused by the human papillomavirus, and especially high-risk human papillomavirus. So this is a very, very good vaccine, which can prevent a lot of HPV-related illnesses, not only cancers that can be caused by high-risk HPVs, but also genital warts that can be used by low-risk HPVs, and vaccine, at least newer vaccines, cover all of that. And also we have a good vaccine against hepatitis B that is now also being used pervasively in many countries around the world. In Croatia, for example, it is used now in the first year of the child's life. And in many countries, the vaccine schedule is adapted to mirror and reflect that as well. So the question is, the answer to the question is twofold. On the one hand, we have a really good vaccine for some of the virally sexually transmitted agents. On the other hand, for bacterial STIs, we don't have so many good examples, but we are hopeful that in the short-term future, we will have at least one viable candidate there.
Great. Thank you, Tommy. I don't know if we have more questions in the chat. I don't think so, but we are already ending now the seminar, and I just want to thank you again for your participation, and also just tell the students that you are, and I am too, because I'm involved in the course, also available via the Google Classroom. So whenever you want to contact me or Professor Tomislav, you can do it there. Thank you, everyone. Thank you again, Tommy. I hope we can meet in person soon, and have a nice day, everyone. Thank you, and enjoy the course.
Thank you, everyone. Bye. Have a nice day, and we'll be in touch during the course. Thanks a lot.
Thank you, Tommy. Bye.
Bye-bye.